TV9 Digital, I am Adarsh Vevachedu. Half of COVID-19 patients with secondary infection are dying as per an ICMR study conducted across 10 hospitals. A secondary infection is one which occurs during or after the treatment of another infection. The ICMR study found that 4% of the 17,000 COVID patients studied had secondary bacterial or fungal infections. Secondary infection usually involve prolonged hospital stay, needing higher doses of antibiotics to keep hospitalization-acquired infections at bay that typically develop after 10 days. While the COVID-19 mortality across the world is 10%, the ICMR in its study on COVID patients with secondary infections found that mortality in this group is at 56.7%. The study further noted that several patients were administered powerful antibiotics as they had superbugs that couldn't be treated with usual antibiotics. Half of the COVID patients with bacterial infection, that is 52.36%, were given watch category antibiotics as per the World Health Organization. These are meant to be judiciously used for specific types of infections. 1/5 of these patients were given antibiotics categorized as last resort or reserve category. So are we doing something wrong here? Could deaths in the COVID plus secondary infection group be reduced? I had a word with Dr. Sitesh Roy, clinical immunologist from Mumbai, on what can be done to address this issue. I asked him if poor infection control on our part is killing COVID-19 patients who would have otherwise survived.
So Adarsh, when it comes to mortality or death due to secondary infections in COVID-19 patients, there are clearly multiple factors that are involved. First, the naturally lowered immunity of the patient because their body is actively fighting an infection which not just compromises their respiratory tract or oxygen but also compromises their blood circulation through microthrombosis or clots, as well as the immune system being totally charged towards fighting it and hence not being available to protect ourselves from the fungi or the bacteria that we normally harbor inside and around us. The second reason clearly would be a lot of antibiotics being used unnecessarily, and certainly with the shortage of cleaning staff, care staff and other people around so many hospitals in the country, infection practices or infection control practices could clearly be suffering, and that could also contribute to these infections developing.
So is it time to revisit the antibiotics classified by WHO under watch category and last resort category? They don't seem to be ensuring lower mortality. And how big a role could growing drug resistance be playing in patients developing secondary infections?
So Adarsh, antibiotic resistance is a huge problem and has been a huge problem in India and other parts of the world long before COVID-19. Irrational prescription of antibiotics for common viral infections that do not warrant it, patient or family pressure on doctors to prescribe something when a child or an adult is sick, as well as a lot of other practices have led to what is called MRSA infections, VRSA infections, VRE infections. These are all different bacteria that don't respond to common antibiotics. And if a person were to catch these in the hospital environment where they tend to be more common, which is called a nosocomial infection, then their chances of getting a drug-resistant infection is very high. This clearly requires a lot of physician education, patient education, and designing of first-line, second-line, third-line antibiotics which can be appropriately used in the right setting, so that when we need the WHO watch class or high potency antibiotics, they are working for our patients.
How crucial is the hospitalization period for those with COVID-19 and secondary infections in terms of hospital-acquired infections? Do we need an overhaul in protocol to more effectively deal with cases in this particular group? The ICMR is blaming bad infection control practices and irrational antibiotic prescription practices. Your thoughts?
I do believe that the longer the hospitals stay, the greater the chances of acquiring a new hospital acquired or nosocomial infection. So, certainly having a high vigilance and having a team looking at how soon patients can be discharged for home management will help reduce their risk of acquiring an infection secondarily. Certainly, infection control practices do need to be monitored by a hospital team again, and with the use of PPE kits, gloves, proper kind of sanitization, making sure that everything is carefully monitored, we can reduce this risk. The irrational use of antibiotics I have already spoken about is a huge problem both outside the hospital, in outside outpatient practice, as well as inpatient in hospitals. And even in COVID, when we see patients receiving azithromycin, doxycycline, plus other medications all together, we know that there needs to be more rational use of antibiotics, or we would be digging our own holes that we then fall into of multiple drug resistant bacteria.
If you like the information that I brought to you, make sure you like and share this video, and yes, subscribe to TV9 News on YouTube, Facebook, Instagram and Twitter. Until next time.